vitamin E is a fat-soluble vitamin. It is composed of 8 different compounds, and the most biologically active form is alpha-tocopherol, which means it has enough vitamin E in it to meet human requirements. It is an antioxidant, so it protects the fatty acids that are embedded in the membrane. So basically, an antioxidant will protect from free radicals trying to steal electrons from other cells. So it will donate an electron. You can see in the picture right there, the antioxidant donates one of their electrons to the free radical to make it remain stable. So these are some of the food sources with vitamin E. You can see there's tomatoes, pine nuts, hazelnuts, red bell peppers, canned sweet potatoes, and canned pumpkin. It's important to know that they can be easily destroyed through food preparation, so it's best to cook with little oil and bake at low temperatures, so don't fry them. And it's also important to store them in airtight containers.
Okay, so in 1922, Herbert Evans and Catherine Bishop were working at the University of California, Berkeley, and they were studying on rats. They gave the rats a semi-purified diet, and the rat babies kept dying. So they changed their diet to a diet of just lettuce and eventually wheat grain. And they found that the rat babies were becoming healthier. So they called it Factor X because they didn't know what to call it yet. And that was what was missing. And then they found it. It was in the lipid extract of the lettuce. And so they called it the anti-sterility factor because it started helping the babies become healthier.
Okay, so recommended dietary allowances are the same for male and female. I don't know where they all are on here. They're all on the other one. Okay, so infants, it's 4 to 5 milligrams per day. Children 1 to 8 is 6 per 7 milligrams per day. Children 9 to 13, 11 milligrams per day. 14 plus is 15 milligrams per day. And then women that are breastfeeding, it is 19 milligrams per day. And then sources, it's pretty easy to get an adequate intake of vitamin E. Almonds, in 1 ounce of almonds, there's 7.4 milligrams. Cooked spinach, 1 cup has 6.7 milligrams. Sunflower seeds, 1 ounce has 10.2 milligrams. So the upper intake level is 1,500 milligrams per day. It's pretty hard to overdo it unless you're taking a lot of supplements, but it's better to get your vitamin E from plants and animals, like straight food anyway.
So many adults, they take large amounts of vitamin E for a long period of time, but there's no really side effects of harm. There are minor symptoms if you do this for a long period of time, such as muscle weakness, fatigue, nausea, and diarrhea. However, since it is a rare toxicity, the most significant risk you could have is excessive bleeding, but it's really uncommon unless the dose is over 1,000 milligrams per day. The supplemental form of vitamin E is less biologically active than organic vitamin E, so if you take the supplement, it's less likely for you to overdose on vitamin E. And of course, it is treatable. Like I said, if you don't go past 1,000 milligrams per day, then you'll be good.
So deficiencies are uncommon, but causes of it are going to be diseases or disorders that cause fat malabsorption and inadequate intake of vitamin E. Signs and symptoms of deficiency is dry hair or skin, anemia, degeneration of the retina, which causes blindness, and muscle weakness or pain. And diagnosis is they just do a ratio of the tocopherol with your total plasma lipids. And then a low ratio suggests that you have a deficiency, and treatment is a supplement.
So
summary, a couple of really good benefits. The main benefit to vitamin E is that it's an antioxidant. It slows aging process by reducing free radical damage, and then because of that, they're starting to look into vitamin E. Studies have shown that the higher your vitamin E levels are, the lower cause of or risk of cancer you have. So they're starting to look into studies. There's no like proof that it can prevent or cure cancer, but it's definitely something to add to your diet if you're looking to lower your risk.
Okay, and then for the second part of the summary, I'm gonna ask you guys questions, and then we have nuts for like our activity plan or to give out to you guys. So if you're allergic to nuts, please don't take them. Okay. So in what year was vitamin E officially named? Okay, so it was in 1925. What is the RDA for our age group? Oh, she's in our group. What's the RDA for our age group? What is the main cause of vitamin E deficiency? Yeah. And then why is vitamin E such an important antioxidant? Yeah. Yeah. Okay, and then if you guys want nuts or you guys answered a question, we can just pass them out to you.